Let's get going then. So what we're going to cover today is what are multiple mini interviews, MMIs, how to structure your answer when you get to your interview, which will be very soon, okay, because that's the next hurdle. One of the last few hurdles between you getting an offer from your favorite medical or dental school. How to utilize your work experience. So I'm hoping that most of you have got some work experience under your belt. If you don't have much, I've got a little work experience clip I'm going to be playing later on as well. But how to utilize that work experience and shine through using those examples, and how to secure an offer. So what are some of the resources available? As I said, I'm the founder of The Medic Life. So over the last 5 years, and then prior to that, I used to do a lot of medical application stuff with other companies or even some myself. But with The Medic Life, the company is now 5 years old. And we started off quite small in little classrooms. These are pictures from pre-COVID days when we used to do a lot of stuff in person because we had a smaller number of audience. Imagine having 291 of you, or 259 of you actually now, in a room. It would be a nightmare. But so we run a lot of stuff online now, and the aim is to help you guys with your applications to medical or dental school. Right, and the next thing is going to be MMI courses that we're running. Some of you have already got yourself a ticket. There's a few remaining. I'm going to tell you more about that shortly. So 2024 so far, it's been incredible. This year has gone by so quick, and we had the Work Experience Workshop in April. We had multiple medical and dental school admissions workshops where I talked to you guys about your UCAT and things like that. We had a personal statement workshop a couple of months ago, and we had 5 UCAT courses over summer as well. And from looking at your scores, looks like those worked a treat. Quick question, is this just for undergraduate medicine into your graduate too? It is for everyone, because you're going to get multiple mini interviews, and I'm going to show you a list of all the universities soon. But undergraduate applicants for medical or dental school and graduate applicants for medical or dental school, it is open for you all. I'm not going to keep a very close eye on the chat box, so if you have some really burning questions, please put them in there. Otherwise, wait for the Q&A. That's going to happen towards the end. So let's carry on to the next slide, and that's a really lovely picture from April, which feels like yesterday. It is insane. And then up next are multiple mini interviews. MMIs is how you will know them. Like I said, we over the last few years have run some incredible courses. We've got a huge bunch of some incredible interviewers. The ones you see in the top picture, this is a course that we ran back in 2019. A lot of these guys are towards finishing their medical or dental school, if not doctors or dentists already. And we keep bringing back some of our favorite students who performed really well. We train them up and we make them interviews as well. But this is to come, right? Let's go back into today. So why are MMIs so important, and why am I doing a workshop for you guys on Monday evening about this? If we look at a list of all the UK medical schools, okay, so this is a list of all the UK medical schools, about 46 of them, and this is how many of them are going to do MMIs for you. So if you apply to these, you're going to get an MMI. So it's pretty fair to say that all of you here today are going to get, most likely, and if you get invited for interviews, most likely it's going to be MMI. So this is for medical school. Similarly, there's not as many dental schools in the UK, but this is a list of the dental schools, and majority of them, if not most of them, do MMIs. Right? So MMIs are important, and you do need to be ready for them. And the main issue when I was in your position, when I was applying for university, is that universities just don't give you enough notice. And that is the last hurdle, because if you've kind of got through your personal statement, you've got through your UCAT, you've done UCAS applications, and then you're applying, right? Pretty much it all comes down to your MMIs. If you score well there, you've got a really good shot at getting that offer. And then depending on where you are, if you are studying A levels, then it depends on your grade. So that's the final little hurdle. So for me personally, I always say this to students that I teach, and I've been doing so over the last few years, is until you do your UCAT, the UCAT's the most important thing. And then once you get to interview, once you've passed those hurdles, the interview is the most important thing. So most of you probably have never been to an MMI. I'm sure a few of you guys may have applied last year, you went there or not, but most of you, I'm sure, have never been to an MMI. You probably don't even know what it would look like. So this is a picture of a rough kind of, you can imagine what MMIs are all about. There are multiple interviews. So you go from one station to the next station to the next station. Now, I've been to a few, I've sat on panels on a few. Obviously, we run our mock circus all the time. So just to kind of lay out the scene, most universities have now started doing in-person MMIs now. Some still do online. through breakout rooms on Zoom, for example, but most of them do it in person. So think of like a big room that are usually divided into cubicles using screens. In this case, in this picture, we've got a corridor with multiple rooms either side, okay? And what you've seen is a group of people standing outside and they're reading a prompt. So normally when you go to your MMI, you go in that day and you will essentially have a little introduction session. You'll get registration. They'll tell you how everything's going to work. You'll be in a small group of like 8 to 10 people, depending on how big the MMI stations are. And then you will basically go around each station. There will be an automation like played on a speaker, which will say, move to the next station. 5 minutes start now. 1 minute remaining. Move to the next station. Start your reading time. Things like that. So on average, and I've looked at a lot of universities across the whole of the UK, and you're going to have about 8 to 12 stations. Now, obviously, there will be some universities that don't stick to that model, but on average, you can expect to have somewhere between 8 to 12 stations. Our MMI course, we have 12 stations, right? So we try and max things as much as we can. Some universities will only give you like 3 stations because they would make each station a lot longer. But majority of the universities will do 8 to 12 stations, and they will give you somewhere between 5 to 7 minutes. 5 minutes being the main amount of time that they give you. So on average, if you think about 5 minutes per station, this is actual questioning and answering or your role play scenario, whatever you're doing. On top of that, you'll have the reading time, which is what these guys are doing in the picture. So before you go into the cubicle, you most likely will have 1 to 2 minutes reading time, usually 1 minute. Okay, some universities have been known to give 2, but usually 1 minute. Now this 1 minute, guys, is probably the most crucial bit. You're going to be stressed. You're going to be panicking. I know, been there multiple times. Try and absorb what the prompt says. So that prompt will tell you, for simple stations like this question is about your motivation to study medicine, easy, right? You don't need to read much. But for like role play stations or problem solving stations or communication stations, there's going to be a bit more information on it. And you need to pick out the key bits, right? Just like verbal reasoning, you need to pick out the key bits. Here, pick out the key bits like what's the name of the person you're talking to? Are you going to go talk to a stranger or are you going to go talk to a person? Think about how you're going to structure your answer in that moment. Most importantly, think about how you're going to introduce yourself, right? When you go into a station, most of these stations are going to be stations where they want to get to know you a little bit more. So go in with big smiles, right? Say hello, good morning, good afternoon, whatever it is. Sit down nicely and wait for your station to start. Someone's just asked, can you bring highlighters or writing equipment? Different universities are different. Most of them probably won't allow any. Okay, if they would allow it, they would have a pen and paper inside anyway for you. But most universities won't, and therefore don't plan on taking any equipment with you. Right? You can have a pen with you if you want, but try and practice when you are preparing to do it without any notes. All right. So introduction is key. So going in and introducing yourself well is going to be super important. And I'm going to talk about introductions shortly. And then you may have to sit in silence if you finish early. Now, this is the thing that people really struggle with and they really worry about, right? So in terms of, because it's 5 minutes per station and each station will be the same amount of time, you may have a role play station, which you're not going to finish because you'll never finish that. That conversation can keep on going forever if needed, depending on the actor. Or you will have a station which is just one question, like, why are you doing medicine or why are you doing dentistry? In which case you'll probably finish in 2 to 3 minutes. And don't be anxious to sit there silently. That's perfectly okay. Different interviewers at different stations will know the average times of their stations. I, as an interviewer, would much rather you give me a good answer in about 3 minutes and then stay quiet for 2 minutes than waffle on, go off tangents, try and fill the whole 5 minutes, leave me confused, right? A shorter, well-structured, concise answer will be the better answer 100% of the time. All right, so that's what you should. So don't get anxious about sitting there in silence. If you get to the stage where you finish your answer, but you think that you missed a point, have a look at the prompt again. That prompt might also be inside. And if you really want to add a point, be careful if you're about to add a point. If you really think it's necessary and it's going to improve your answer, then say to the interviewer, "I'm sorry, I missed a point. Do you mind if I say one more thing?" And they will like, "Yeah, sure," and then go for it. I would not advise small talk and I would not advise being chatty. Just stay there in silence, all right? Because unless they start it, they may see you're nervous, they may try and calm you and be like, "Oh, how was your journey?" Don't start it yourself. If the interviewer starts a bit of small talk, if you're saying that in silence, fine, all right? But don't do it yourself. Right, so there are some pros and there's some cons to multimedia interviews, all right? And one of those, So let's start with cons, and let's start with the first one. So it's long and tiring, okay? Whereas in the past, your panel interview would be about 15 minutes, 20 minutes, and that's it, done. Your MMIs, from start to finish, by the time you get to the university, you're going to get there early, you're going to register, you're going to have an induction, you're going to go into the room, the whole thing's going to last about 45 minutes to an hour. So altogether, it could be multiple hours. That's exhausting, especially when you're at that high state of stress as well, okay? So it's long and tiring. This is again why instead of just doing one mock MMI circuit, we do 2 mock MMI circuits at our courses, just to get you to feel what that's all about, okay? And building up your endurance. So when you are prepping and you are, getting someone to help you or kind of run through questions with you, don't just do one at a time, do loads so you can build up that endurance as well. There is not enough time at each station to build rapport. And that is a bit of a problem, because if you go to a panel interview, you can be a likable person. Doesn't mean you don't try at all. So still go in with a big smile, say hello to them. Don't do too much small talk, but try and be just friendly and nice. The idea is to be likable, but not too memorable for the wrong reasons, right? And when you're answering your questions, your aim is to try and sell yourself. You're there at an interview, not there just for a friendly chat. Or they're not trying to persuade you, you're there to shine. So still showcase your skills and be excited. So when you're talking about your work experience, you're talking about why you want to do medicine or dentistry, you're talking about yourself or situations that you've been in, be enthusiastic, naturally. Be yourself. Don't try and mimic someone you think they want to see. Totally be yourself. Interviewers don't know you, so don't assume that they've read your personal statement. So if there's something in your personal statement that you think is going to help you stand out, mention it. Talk to them about it. Tell them that this is a bit of the experience that you learned this from. All right, we're going to go on to doing some examples shortly. But yeah, so bring in these extra things. Don't assume that they know you already. You mentioned they don't have enough time. So you guys should start practicing now. Okay, so start prepping your interview stuff. Now, like I said, our first MMI course is this Saturday. So you should start doing that. Not enough time or too much time is the issue. As I said earlier, you may sit in silence. Alternatively, the caveat to that, on the contrary, is you may have some stations where you just can't get through all the things that you want to talk about because there's not enough time, right? So some of the role play stations, some of the ethical stations, there's lots of things you want to say. Now, one thing you can do to beat this is you can signpost. Now, what I mean by signposting is, let's say, just to give an example, they say to me, why do you want to do medicine, Bakhtar? For me personally, the 3 reasons, the rule of 3 works great. Always talk about 3 main things every time. Okay, I would say, firstly, my introduction to medicine was quite young and from a young age, and early on, my dad was an orthopedic surgeon. Secondly, it's my work experience. It gave me a huge insight into the career. And then finally, I would like to tell you about why science makes such a huge impact to me. So if I start off with the first one, that's what I mean by signposting. So the 3 things I'm going to talk about over a course of 5 minutes, I've just spent the first 10 seconds telling them about the 3 headings, 3 subheadings essentially. So then even if I run out of time, the interviewer would know that, oh, okay, this guy was also going to tell me some more stuff, so they probably would have covered it. This works really well in ethical stations. So for example, let's say an ethical scenario is we've got 2 patients. One is a 60-year-old who has had really bad lifestyle habits and has got heart failure now. And one is a young person who's got a heart murmur defect because of a congenital problem that they were born with. Who would you give the heart to? Right? That's an ethical scenario. There's no right or wrong here, but we want to see what your thinking is like. So you could signpost here as well. So you could be like, okay, this is quite a complex scenario and not something that one person would make the decision on. It would be a committee that would decide on this problem. But if I were to put in my input here, I would kind of see it as 3 main things. So the actual genetic matching of the heart, is it suitable for these people? The quality adjusted life years, who is this heart going to affect or benefit the most? And then finally, I would like to talk about the ethical scenarios. The ethical pillars. So let's start with the first one. That's signposting. That, honestly, if you do that well, immediately what your interview is going to do is they're going to smile and they're going to give you a little tick next to your name. They're going to be like, yep, I'm happy with this person to come to my medical dental school. So this is where signposting and introductions are super, super, super useful. When do universities usually hold their interviews? They start as early as November, like early November, and then they go all the way to March, April time for some of them. Most universities do them super early. I kid you not, I got 6 days notice. 6 days. I got told at the beginning of November that I have an interview in the middle of November. Like, that's how quick it is. So you guys need to start prepping now. All right. And then you can't lead your interviewers. So whereas in a panel interview, you could say to your interviewers like, this is why I want to do medicine because of my work experience, hoping for them to ask you about your work experience, and then you tell them. So that's how you would lead them in a certain position. But in MMIs, they have a list of questions that they have to stick to. So don't try to lead them, because they probably won't follow you. They'll just stick to their list. So if you want to say something, say it there and then. Okay, so if you think something's going to benefit your answer, the example that you want to give it there and then. Right, guys, so that is enough of the cons. Let's go on to some of the pros, some of the good things. Now, I personally, when I was at your stage, I used to be so terrified of MMIs. I was like, you know what, they are so scary, they're so much longer, and all these cons, rightly so. But you know what, so is everyone else. So are all the other thousands of people applying for medicine and dentistry. 38,000 people at the UCAT. That's how many people are applying for it, right? And if you are able to stand out from the crowd just by doing a few things that make you better, you'll easily get your offers from medicine or from medical or dental schools. Okay, so let's look at some of the pros. You can reset after each station. So we're all humans, we all make mistakes. I make mistakes. During my third year OSCEs at med school, OSCEs are like your clinical examinations, and they are set out in a similar fashion. You go from one station to the next, and so on. And I remember we had like a cardiac station, you had to listen to the heart, there was like a abdomen one, and then there was a knee exam. I flopped my knee exam like so hard. I knew straight away, as soon as I walked out, I kind of laughed to myself. I was like, that was horrible. That was so bad. I'm failing that station. But I reminded myself, like, you know what, that's just one of 14 stations I've got today. Let me go and smash the rest. I've prepped everything else. Bring it. And that mindset of coming out of a bad station and reminding yourself, okay, you know what, big breath, deep breath, forget about it, let's start again. So don't let that keep playing on your mind. If you have a bad station, it's okay. All right, especially your role play stations, you'll feel like you flopped it, even if you did well. Just remember, it's okay. It's like verbal reasoning. Verbal reasoning is horrible, but then everything after that gets a little bit better, doesn't it? It's really fair. The reason most universities have started doing MMIs as opposed to panel interviews is because you have a wider variety of interviewers that are assessing you. And there are like performers, there's checklists that they go through, there's different types of questions. And although everyone gets asked the same question in that circuit, the circuit in the afternoon would be different questions, for example. And then the one the next day would be different questions, but the theme would stay the same. And we're going to focus on the themes shortly in a couple of minutes on the next slide. So yeah, so it's a lot fairer, and therefore understanding the themes that you're going to get assessed on will help you predict some of the questions. And you'll obviously get some questions that you won't know or have ever seen before, but that's how you structure your answer well, and we'll come on to that as well. And then finally, there's a variety of questions. So naturally, all of you will have strengths and all of you will have weaknesses. And my job and the job of my interviewers when you come to our course is to help you understand where those strengths and weaknesses are, get you to perform even better on your strengths, but also help you identify those weaknesses, give you personalized feedback, and turn them into strengths as well. So you just shine all the way around, despite what you might find more challenging. Right, so let's go on to looking at the 5 main areas where you will be assessed. Now, different universities would word these differently. If you go into the university portals under interview, they'll tell you like, we assess these things, blah, 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 right? But essentially, that's their way of saying the 5 things I'm about to tell you, which is what interviewers are going to be assessing you on. So first one is interpersonal and communication skills. So this is going to get tested throughout your interviews. This is them assessing like how you talk, what kind of body language you use, your hand gestures, are you smiling? Are you generally a confident person? Are you happy? Like the things you're saying, are they genuine, right? And then communication skills, those will be tested in like communication stations where you may have to explain something. There may be a breaking bad news station. Like the notorious thing is like, someone's pet died, or a family member got a bad diagnosis, things like that. What they're kind of assessing there, like I said, it's not about the resolution of the problem. It's more about how you deal with it. Have you got empathy? Are you showing that you care? Are you listening to the person? Don't just keep rambling on. Notice how the tone of my voice has calmed down a little bit. Things like that. Right? So that's where they assess your communication skills. So in those situations, let the person talk, see what they're giving you, especially the actors, and then kind of probe them to get what they really want. And there's this acronym called ICE, ideas, concerns and expectations. What do you think is going on? What are your concerns? What worries you? What's your expectation? What would you like me to do for you? What can I do for you? What can I help you with? Right? So ICE is a really good tool to use with these kind of stations, right? Remember that one. Write down. Okay, so that's interpersonal and communication skills. Another thing you can do is introduce yourself. All right. So if you have a station like you are a med student or a dental student at the practice, and you've been asked to go and talk to Mr. Smith about their lifestyle habits, something like that. Okay. Look at the two differences I'm about to give you. So you come into the station. Yeah. Hi. Nice to meet you. Hi, nice to meet you. I've been asked to talk to you about some of the things that you've come in today. That's one example. That's what most people do. Trust me, I interview them. How about this one? Hi, my name is Bakhtar. I'm one of the med students here. Can I check? Is it Mr. Smith? Hi, very nice to meet you, Mr. Smith. I've been asked by the doctor today just to ask you before you see the doctor about what are some of the reasons that brought you in. I would then go and present this to the doctor, and it's more for my learning, but also just to kind of get you some kind of questioning now, and then I can pass those on to the doctor as well. Now that is an example of a good introduction, right? So, and you can introduce yourself in different ways. So even stations where you're going to go in, like a work experience station, you can still go in and say, hi, nice to meet you, I'm Bakhtar, before you start, because that's just one with the interviewer is going to ask you a few questions, and even an informal introduction is still useful. Right, let's go on to the next one, teamwork and leadership. Now, it's what it says on the tin, right? So doctors and dentists, the idea is that they have great teamwork and communication leadership skills, and you may be asked about different variations of this to kind of showcase your understanding of this. As I was saying, I made a reel on this a couple of days ago, but have 3 examples of where you worked in a team, okay? So within those 3 examples, you could have an example where it went well, a situation where you worked in a team and it didn't go so well, and kind of like what you learned from it. So that's your teamwork examples, and then similar examples for leadership as well. Now, your leadership examples don't always have to be a bit about you being the leader. It could be something that you've seen in a particular scenario, or even work experience. And I'm going to play a short video in a couple of slides' time where we focus on this teamwork and leadership and how to kind of showcase those skills and talk about certain skills. Preparation and motivation. So preparation and motivation is all about you and how you've come to the decision of applying for medical school or dental school. This includes work experience. This includes all the research you've done. This includes the work experience workshop you guys came to, all the hours of kind of understanding you've got, all the junior doctor strike stuff that you've read up on the news, and like keeping up with this. So this is the homework element of your interview. This is the stuff that you need to go and research. So when it comes to this stuff, there's 2 main areas that you're trying to showcase. One, if we go to this side, is this is the reason I want to do medicine or dentistry. And if we go to the other side, this is why you should take me. Because you're at an interview. You're not there for a chat. You're not there at an open day. You've been invited for interview, and the ratio at that stage is about 1 to 4, 1 to 3, in terms of like they're going to take 1 person and reject 3 people. That's how savage it is. So you need to show them, make their life easier, that take me because this is how good I am, or this is why I'm so certain I want to apply for medical or dental school. So when it comes to like this preparation and motivation questions, you should always end with that. All right. And then critical thinking and problem solving. Now, these are the stations that sometimes will come up and they will throw you off. Okay. I'll give you an example. So a few years ago, my youngest brother, who's currently a final year medical student at St. George's, he went to another university for interview. I won't name who, but he went to another university for an interview, and he went to a station. I took him there. I drove him up, and then after he finished, he came, and I was like, how did it go? Like, I prepped him, so I was like, how did it go? And he's like, that was a really weird station. They gave me a list, like a step-by-step instruction list, and then gave me some things and told me to put a plug socket together, right? Like, that's more of an engineering kind of thing, right? But he'd already been prepared for that, because although that sounds something completely random, it's assessing not your ability to put it together, but your ability to kind of follow instructions, right? Are you someone who panics when the clock is ticking and you haven't finished? And I was like, how many steps were there? There were like so many steps that it was impossible to finish. And they did that on purpose because they wanted to see not how quickly can you put it together, because that's what everyone thinks they need to do, is how you kind of formulate a plan. How do you lay out all the things? Do you just start without actually planning, or do you plan a few things, plan your steps ahead, and then start? So those are the kind of things. You may be asked to describe something. You may be, another example of a question I've heard from people is you go to a scene of a crash, a car and a bicycle, and there's a child walking on the road, there's a pregnant lady in the car, there's a cyclist on the road, on the floor. What would you do first? Right? So these kind of things, there's no right or wrong answers here. But what we want to see as interviewers is we're trying to understand, are you someone who can problem solve, think critically, and what is your rationale behind what you're saying? So I don't care what you say. There's no right or wrong answers here, as long as you can give me a rationale for what you're doing. So just to give you an example with that particular station, what I would do is, first thing I would say, actually, that seems like there's a lot going on and we clearly need some help. So I would ask someone to call the ambulance and the paramedics or police as well. But most importantly, I would check, is the area safe for me to be there? Safety always comes first. You say those couple of things, already the interviewer knows, you know what, this person has got their head screwed on properly, and they know what they're doing, because they're showing me skills that doctors and dentists are taught to have at medical dental school. They already have these skills because I told you, right? So this is the kind of stuff that really helps you stand out. And then finally, ethical reasoning and integrity. So as we were talking about earlier, the example of a heart transplant, we've got one heart, we've got two patients who we're going to give it to. So your introduction, your signposting would be like, there's three things I want to talk to you about today. The genetic matching of the heart, is it even suitable to go into either patient? I want to talk to you about the quality adjusted life years, QALY. Who is this heart going to benefit the most? And then I would like to touch upon the 4 ethical principles. So autonomy, beneficence. So autonomy is your patient's right to make decisions for themselves. Beneficence, you're going to act in the patient's best interest. Non-maleficence, you're not going to hurt the patient or not act in a way that harms them. And then justice, you're going to be fair. So those are some of the principles you could talk about. And then finally, you would make a conclusion. So this is why understanding those principles and not just name dropping those principles, really understanding them and using them appropriately is going to help you stand out. So yeah, those are the 5 main areas. Can you repeat the 4 again? Okay, so beneficence, acting in the best interest of the patient. Non-maleficence, not harming them. Autonomy is your patient's ability or right to make their own decision about what's best for them. And then justice, which is you being fair and just for the whole public. Cool. And then someone else says, what does the C mean in ICE? Ideas, concerns, expectations. Well done, guys. All right, awesome stuff. And then let's go on forwards to how to structure your answers. So this is the bit which is super, super important. And this is also the bit where I see a lot of students either doing really well or making a lot of mistakes. There's no in between. Like, there's a lot of mediocre stuff, but either the ones that do really badly and I'm like, nope, you're not getting in, or the ones who I'm like, wow, you are going to smash it. And guys, I'm getting loads of questions. Remember, the Q&A is at the end. Leave the chat box for just really like urgent emergency stuff, all right? Says the A&E doctor. But yeah, okay, just because I can't keep an eye on that and present at the same time, so I'll do a proper Q&A. Trust me, you'll have an opportunity to ask me lots of questions at the end. So answer the question. Now that may seem really silly and really straightforward. About half, if not more than half of the people get this wrong. So I may ask someone, why should I take you? Why should we take you? And they'll start like for the first 10 seconds, but then they'll deviate because they've over rehearsed, and they'll deviate into like either telling me too much about their work experience. They'll go off on a tangent about telling me about why they want to do dentistry or why they want to do medicine and so on, right? They won't stick to actually the question I've asked them. So remember, when you are outside the station and you've got that 1 minute to read the prompt, understand what the question is, how you're going to answer it, and how you're going to structure the answer, and therefore signpost it. Signposting, like, for example, telling the person what you're about to say, helps them keep track and follow what you're saying, but also helps you keep track of what you're saying. Next up, give examples. Interviewers, okay. This is where I want you to think of, put yourself in my shoes, all right? Because I know what your shoes are like. I've been there, but you've probably never been in my shoes, right? As an interviewer. For you, going to an interview is probably the most important day of your life, and you're like, oh my God, this is the biggest thing ever. I'm so stressed, blah, blah, blah. For the interviewer, they've been doing this every day for the last 3 weeks, probably, right? You are one of hundreds of applicants that they're going to talk to that day. So you need to tell the interviewer like a story with examples, which keeps them engaged, doesn't get them bored, and make them start thinking about what they're going to have for lunch, right? And you need to put it really nicely, concisely on a plate for them and serve it to them like, this is why you need to give me the offer. So give them examples, make the story a bit interesting and engaging, and then reflect on the examples you've given. There's no point telling me, oh yeah, doctors are amazing, they have such good communication skills. I know, that's why I chose to be one, right? But what you need to do is tell me how you also have those amazing communication skills. Bring in other examples from your extracurricular activities or your personal life experiences where you would have shown similar examples. All right, so let's do a demonstration. I'm going to give you a demonstration right now. And I'm going to also tell you a little story. When I was at your stage, and I was applying for medical school the first time around, and the reason I do this for med students and dental applicants is because, like I said, applications process is pretty similar. Half my best friends are doctors, half my best friends are dentists. We all applied together. We all went to school together, right? And like I know how their lives are, and the application processes are so similar, experiences are so similar, and so on. But one of the mistakes I made was I over-rehearsed my answers. I wrote them all down. I tried to remember them. I used to rehearse them in the shower. I used to rehearse them everywhere. Come my interview, I got asked the question, and the stress of everything, mind blank, total mind blank. I couldn't remember anything. I said some random stuff that I don't even remember. Absolutely flopped my interview. Flopped the next one as well, same problem, and didn't get into med school. Second time around, absolutely smashed it because I learned from all my mistakes. I learned different things. I did a lot more research. I did a lot more prepping. And essentially all of those things and the last many years of experience and having interviewed literally thousands of people, I've come to the stage where I created a course and a formula which just works every time, right? So the rule of 3 works really well. So for example, answer the question, give examples, reflect on it. Why medicine? Tell me 3 things, right? Why should we take you? Tell me 3 things. Why do you want to come to our uni? Tell me 3 things. That's it. And signpost those 3 things. So let me signpost the answer I'm about to give you right now. So the way I'm going to answer, so let's say this is a tell me about your work experience question, which you're probably going to get. I'm going to answer it using my work experience from many years ago where I shadowed an orthopedic team for a week at Hamilton Hospital. That's my bullet point. That's all you need to remember, okay? Don't write down paragraphs and paragraphs, write bullet points, just a few words. So I would write 3 bullet points in my notes would be my work experience at Hamilton Hospital, orthopedics. The example I'm going to give is the hip operation. That's it. Because I have it in my memory. I lived that experience, so I should have it in my memory, right? And then the reflection I'm going to do is with my gap year job as a donor carer. And then I go in, and whatever variation of the question they ask me, I've got my 3 points. So I'm just going to start talking about those 3 points. And every time I give this answer, it's different every time because it's genuine. And the words in between, I improvise on the spot because we all know how to talk, right? So that's what you do. So let's start the answer, okay? So Bakhtar, tell me about your work experience. Right. I actually was very lucky to have quite a lot of different experiences from psychiatry. I did a bit of GP as well, but my favorite one that I want to tell you about today is when I got to spend 1 week with the orthopedic team at Hamilton Hospital. And I did pretty much everything that everyone was doing. So for example, the ward rounds, I managed to see what the junior doctors were doing in terms of creating a list of jobs. I sat in clinics with the consultants and the registrars, like fracture clinics, and what kind of advice they gave to the patients who were not staying in hospital. But my personal favorite, and honestly I was over the moon, was one of the days the consultant said, do you want to come into the theater to observe this surgery? And honestly, I was so excited. I almost jumped and said yes. And the nurses and the whole team were incredible. The nurses showed me how to scrub in, how to wash your hands appropriately so you're aseptic. They got me gowned up. And then whilst the patient was being prepped, the consultant was showing me the x-rays and teaching me on how to read an x-ray and where the fracture was and what kind of things they were going to do. Once the patient was on the table, the operation had started, the registrar was actually leading the operation, and the consultant was just kind of supervising and training them and assisting a little bit at the same time. And about halfway into the operation, I was just sat there like, wow, this is incredible. And all of a sudden, blood starts spurting out of this woman's leg. And in my head, I'm thinking, wow, that is an absolute disaster. This person's probably cut their artery. I had read somewhere that you can bleed out from the femoral artery within a couple of minutes. And in my head, I'm thinking, wow, this patient's probably going to die. It's all gone horribly. Like, what's going on? But on the other side of the table, what I saw was incredible. Both the registrar and the consultant and the nurses, everyone, they were completely calm. The consultant put a little bit of gauze on where the bleeding was coming from. The nurse handed the registrar a tool, and then he just cauterized the artery and stopped the bleed within about 2 seconds. I was genuinely blown away at that point, because in my head, what seemed to be a very catastrophic situation was dealt with so much calmness and professionalism, teamworking and communication that they all showed at the same time within a space of a couple of seconds. And I spoke to them afterwards as well, and this is when the consultant said, this is from years of training, we work together, and you don't always have to communicate using words. We can communicate, using other tools like body language and so on. And then I was going home on the bus that day, and I was just trying to think of like, wow, this is incredible. Have I done anything similar? And this is when I kind of thought of, well, actually I have. Obviously not to that scale, operating on someone, but during my gap year, when I worked as a blood donor carer in a blood donation center, my job would be to have donors come in, do a quick questionnaire to make sure they're safe to donate, prep all the equipment, and actually do the venipuncture, so start taking their blood, and then stay with them until they finish, probably about 5 to 10 minutes, and then give them a tea and a biscuit at the end. That was my job, and I used to do that on repeat. And I remember there was this one guy who came in, it was his first time donating blood. He was a bit anxious naturally. And halfway through the donation, he looked a bit pale to me. So I just said to him, are you okay? And he said, no, I'm feeling a bit lightheaded. And immediately I went into training mode. I went into what I knew, what I'd been taught, what I'd done multiple times. I shouted for help. So someone, by the time that the nurse from the other desk came over to me and a few other of my colleagues, I'd already stopped the machine by pressing the button. I'd clamped the cable so no more blood was coming out of his arm. We had these chairs where you could press a button and flick them back, so his legs were high up in the air, so the blood was coming back to his brain. And we avoided him collapsing and avoided an emergency, essentially, because, blood donations, some people do feel faint and some people do actually go on to fainting, and that's, we want to totally avoid that. And we were able to do that. And then it got me thinking, like, you know what? I already have a foundation of trying to stay calm under stressful situations, using my communication skills, working within a team. And by going to medical school, I'll only develop these skills, and with placements and working as a junior doctor, I'll get better and better. And hopefully someday I can be in the situation where those surgeons were operating on that woman. That's it. And you guys are like, whoa, that was sick. But the whole point is, I hope you guys were engaged in that, weren't you? You wanted to, yeah. Someone just commented, raw. Yeah, exactly. That's the whole point, right? It was literally a structure that I wanted you guys to follow. So answer the question, give an example, keep the interviewer engaged, not by telling a story, but a fake story, telling a real story, and then reflecting it all to yourself in the end. Like, yes, the doctors are amazing. Yes, the consultants were incredible. The surgeons are incredible, but I'm also very incredible, and you should give me the offer. That's what it's all about. So that was my demonstration, guys. Hope you guys enjoyed that. Let's go on to kind of looking at some more examples. Someone just said, what if we have no examples? Well, guess what? Monday evening is about to turn out to be the best evening ever, because I'm about to give you an example. So what we're going to do now, guys, for those of you who were at the work experience workshop in April, you may remember this video, but I'm about to play a work experience video for you. Okay. I'm only going to play a short segment of it because I want you to focus on the communication and team working element of this video. So during COVID, going back in 2020, 2019, when work experience shut down, me and a few of my incredible colleagues from my hospital, we all got together. We borrowed the simulation suite in our hospital and we recorded a cardiac arrest simulation for you guys. And I've been using this simulation over the last few years to help people understand how to utilize work experience properly. All right, so let's go ahead and play this scenario. So just bear with me. Let me stop the screen share and I will share a different screen.
A bit unwell, so he's using an 8 now. His rests have gone up.
So you guys should be able to hear that.
He's a
Let
bit more
me know if
tachycardic,
you
his
can't.
blood pressure's a bit lower.
Yeah, I can see his blood pressure's 80/50, so not great.
Amazing. Okay, so that no one has said anything, but that means you guys probably can hear it, which is lovely. Okay, so what this is a video, as I said, of a patient deteriorating. So I've just been called to a patient who's deteriorating. They've been given an antibiotic. Okay, and what I'm going to do is I'm going to skip the first half where I assess the patient and do an ABCD approach. You guys don't need to know that. The audio's a bit quiet. Let me turn it all the way up, and you guys should turn your audio all the way up as well. Right, and what we're going to do is we're going to skip to the bit where the patient goes into cardiac arrest. Okay, so there we go. We're about to do CPR now. So when the patient goes into cardiac arrest, we call out the cardiac arrest team, and that's what we're about to play. And I want you guys to pay close attention to how I give them instructions and how different members of the team talk to each other as well.
Right, Vic, he's unresponsive. So can we please put a double two call?
Sure.
And ask for our adult cardiac arrest team to come over to this room, please.
Can I put out a cardiac arrest call for an adult in ANU?
Hi, my name's back. Are you able to take over from me? I'll count you in. So 5, 4, 3, 2, 1. Go.
So just in that moment, we've put out the cardiac arrest call. My colleagues have joined. Did you see what I just did? Right? Emily, can you take over from me? I'm going to count you down. 5, 4, 3, 2, 1. She jumps in. Okay? Use that example. So how are you going to signpost this? I went to a work experience workshop where this incredible doctor, which I'm joking, put on this simulation for us where he talked us through what happens in a cardiac arrest. And they put on a cardiac arrest simulation. There were 4 doctors, and they kind of showed us what they would do in that situation. And the communication skills, for example, when he was handing over the CPR, he counted down from, he said, I'm about to hand over the CPR to you, 5, 4, 3, 2, 1. And it was so swift where the other person moved in. There you go. And then use other examples. Let's look at more.
Okay. Can we just get the pads? I'm just going to go ahead and attach the pads around you, Emily. Okay. Sorry, I'm just going to get past you. Thank you. Hi there. Hi, Maya. My name's back. I'm one of the medical SHOs.
Hello.
So we've got Sam here. He's a 34-year-old chap who's come in with cellulitis, was given flucloxacillin and allergic to penicillin.
Yeah.
So we've just got compressions going on now.
Fine.
Can I ask you just get the defib pads? Let's get the rhythm check switched out.
Okay.
Okay, guys, we're going to do a rhythm check shortly. So Emily, can you stop the compressions, please? Let's have a look at the rhythm.
So one of the things I'm doing there, and this is again where communication skills come in, you'll notice every time I ask someone to do something, I'm going to say their name first. So because in that moment, when you're doing CPR, you're counting in your head, you're counting up to 30, right? You're doing so many things, your brain isn't everywhere. So everyone has their specific jobs, and the person, the leader here, the leadership skills, right? So this is an example where you can use as a leader, is I witnessed the leader give instructions by actually calling out the person's name first. And this is how they were able to grab their attention so they can then give them a command and then wait for that person to acknowledge that they've received that command. Okay, so this is what you can say. So in this case, I said, Emily, can you stop the compressions? I need to look at the rhythm. This is what I've done now. Okay, and also giving instructions to the whole team.
That's via back on the chest, please. So we're just going to do 30 to 2, and can you guys swap so Emily doesn't get tired?
And I've also just told them that if Emily gets tired, make sure you guys swap. So Vic and Emily now have been given the instruction that they can stop whenever they want.
You ready?
Okay.
And I'm going to hand it over to you, Maya, for the defib. It's a shockable rhythm, so we'll go ahead with the first shock, please.
Sure. Okay. I'm going to charge everybody except compressions away. Charging. Compressions away.
Shock.
Shocking. Everyone back on the chest, please.
Right, great stuff. So that's the first.
That 10 seconds will show you more about communication skills than anything else. Okay, so and teamwork. Notice how Vic and Emily have now swapped. I handed over the command to Maya. I said, Maya, I'm going to give you the command now because she's at a machine, the defibrillator, which could potentially shock all of us. It could damage all of us, right? So she needs to be very careful when she's saying. So she says, everyone but compressions away. So that makes me and Vic move away. Then she charges the machine, looks to see that we're away, then says compressions away. So then Emily steps back as well. Okay, make sure that no one's touching the bed because we could all get electrocuted, and then shocks the patient, and then says everyone back on the chest, so resume. And that all happened within 10 seconds. So again, use that example of communication skills, teamwork, leadership, clear communication to make sure that we can avoid harm and act in the patient's best interest. So I'll show you that bit again.
Compressions away.
Let's just go back a little bit.
Accept compressions away. Charging. Compressions away. Shocking. Everyone back on the chest, please.
Right, great stuff. So that's.
And that was just done beautifully by Maya, okay? And that's what we do. We do this on a day-to-day basis. I work in A&E, we do this regularly, right? That level of communication, teamwork, working together, make sure that we act at the best of our abilities for the patient, right? And this simulation then goes on to run and the patient kind of comes around again. So that's what you guys, a little snippet there for you, looking at teamwork, leadership, communication skills. Use this example in your interview questions if you need to. All right, we're going to stop that here. Let's go back to our presentation. Right. Okie dokie. And then what we're going to do now, so essentially guys, that is a nice like summary of what MMIs are, what are the 5 things you're going to get assessed on, structure. Now I want to talk to you guys about what you can do in terms of prepping for your interviews. Let's just move a few things around here. Right, what you can do in terms of your interviews. So this winter, starting from this Saturday coming in 5 days time, we are going to be running our MMI courses. So every year we have a very select small group of people that we take on. Mainly because it's nothing like the UCAT workshops where we can have more people in a classroom. This is, like I said, a circuit can only have so many people. So we're running 5 courses, 2 of which have already filled up. So there's only 3 remaining now. And we are gonna take you through essentially 2 mock MMI circuits. So you'll have the ability to experience what it's like. So you'll go from station to station. It's all online, so we use breakout rooms. This helps us keep the cost down, and it allows us to basically offer it to as many people as possible for the cheapest affordable price. It's run by doctors, dentists, medical and dental students, people who are really experienced, have got experience from sitting in real interview panels. They've been fully trained by essentially myself. And as I said earlier, I've been doing this for many years, taught thousands of people. And over the last few years, our success rate has been so incredible, 98% success rate, that for the first time ever this year, we're actually giving a full money back guarantee on it. So let me take you to the next slide. So as I said, 2 mock MMI circuits, 1 in the morning, 1 in the afternoon. And the beauty of this course is after you do each station, you get up to 3 minutes of feedback at each station. You then have 12 stations, 2 circuits. That's 3 minutes for 24 stations. And then on top of that, that's all personalized and tailored to you. On top of that, we have group feedback sessions as well. So by the time you come out the other end, you would have transformed and your answers will be similar to the answer I gave earlier, because that's how we coach you. And it's very much tailored. So it's not like this is what everyone should do, because the last thing I want is everyone to sound the same. I want all of you to shine and shine yourself, because you're all unique in your very wonderful ways. So shine through using your experiences, your skills, and we're just going to help you kind of coach you through how to structure it, what kind of things to put in, what kind of things to take out, what you do well, what can be improved, and so on. So these are the 5 dates. Like I said, 26th of October, you've got this Saturday, then the Sunday after that, and then the 17th of November. 1st December, 7th December currently sold out. We'll see how we're doing for tickets, because we can try to add another course later on depending on how we're doing. They're £99. Limited spaces, as I said already. You can use this QR code to go ahead and sign up. And the full money back guarantee, which we're doing for the first time this year, because we're so confident that it's going to get you into medical or dental school. No one else does that out there, because like I said, this is something that I just truly enjoy. Given the fact that we have to kind of pay all our interviewers, these are full-time doctors and dentists, medical students and dental students who need to be paid, the profit margin on these is very little. So the reason I do this is because it just, one is I love it. This is my chance to get to know the applicants who are applying. We then, the ones who are really, really good, we bring them back as interviewers, and then it just makes our life so much nicer and happier to meet you guys. All the interviews, we just fully love it and we enjoy it. And it gives something back to you guys, because I know how stressful it was when I was at your stage. The money back guarantee is, all right, and you'll see this well, first of all, you won't see anywhere else because no one is brave enough to offer this because they probably don't even believe in their own product. We do. The full money back guarantee is go ahead and buy the course today, okay? Because if you don't buy it today, probably won't be any tickets left. Go and get it. You're going to start getting interviews quite soon and you probably won't have much notice. If you do our course, and this is for medicine and dentistry, if you do our course and then you have an interview and you don't get an offer, I'll give you your money back. Simple. That's it. That's literally it. Simple as that. There's no like, oh, you need to do this, and then no, simple. You do our course, and then after our course, you still don't get any offers after interview, we'll give you your money back. All right. So use this QR code. You can sign up to the course. Like I said, there's 3 remaining. If you go onto it and they're all sold out, it's probably because too many people have put them in their baskets. Give it a couple of minutes. It might reset, or you might have just missed out. I've been too late. But yeah, so go ahead and use that QR code. You can do that now. Also, guys, sign up to, or not sign up, like follow the Medic Life on Instagram and TikTok if you don't already, because over the next few months, what we're going to be doing is, well, I'm going to be posting a lot of useful tips on Instagram and TikTok. So make sure you follow that. And then also there is a broadcast channel on Instagram. Some of you may already be part of it, where I send the reels so you don't miss things. I remind you of certain important dates and just useful things that are happening. So that's the broadcast channel on Instagram. If you scan the QR code on the right, you will join it immediately. And then the QR code on the left is for the MMI courses. All right. What you can do is you can get an interview course like later down if you, have a look at your UCAS score. Let's start there. Have a look at your UCAS score. Have you applied strategically or have you just applied randomly? Most of you, because I've been telling you for the last few weeks, months, apply strategically, been giving you a bit of guidance. If you've applied strategically, you're probably going to get some interviews. And when you do get those interviews, you're going to get them very quickly, so you won't have much notice. So the best thing is to always get onto a course as quickly as you can. Start prep today. Today was day 1 of your preparation, I hope, all of you guys. And then keep prepping, because you never know, your interview could just come like that. And then go and smash your interview, get an offer, get your grades, job done, right? And that's what I want you guys to do. Amazing stuff. So I'll take you back on that slide if you want, or actually I've got all the information on this slide anyway. So what we're going to start now is I'll give you another minute or 2 for those of you who do want to go and book on a course, and then we'll start our Q&A for the next about 10 to 15 minutes. So those of you who want to stay for the Q&A, you're more than welcome to. Those of you who want to go and leave here, I wish you all the best. Well done for getting to this stage, and good luck with all the interview stuff that's coming your way. And I will, I'm sure, see you very soon.